Hi, and welcome back to Hey Doc, What's Up? Today we're going to dive a little bit deeper into polycystic ovary syndrome, PCOS, and tell you a little bit more about some of the things that women who have this genetic issue may encounter. Again, this is a genetic issue. We don't know the number of genes that PCOS may actually employ, but we do know that it is something that runs in families. It can skip generations. It can be something that an aunt from a father's side can still contribute to the daughters of a family. It can be as crazy as great aunts contributing those genetics to a woman, but it is something that can be as minimal as a few genes to as many as 7 genes. We just really don't have enough research in that line of medicine to really answer that question. Regardless, it's a genetic issue. So how do you know if you have polycystic ovaries? Well, for the longest time, we didn't really have a good answer, and there aren't specific criteria. If you have 1, 2, 3, or 4, you are definitely going to be diagnosed with this diagnosis. It's more that it's a suggestion of whether you have, if you have 3 major diagnoses, symptoms, and you have 2 minor symptoms, then you might be called a polycystic ovary. And you go, well, that's confusing, and it's not helpful at all. And what I'll tell most women is that's exactly right. So we let them know you have the tendency toward polycystic ovary, but more importantly, do you have any of the issues that may get you in trouble? Do you have irregular bleeding? Do you have infertility? Do you have an increased risk of recurrent ovarian cysts that are rupturing on you? Do you have endometriosis? These are all issues that may go along with a diagnosis of polycystic ovary syndrome. So today what I want to talk about is irregular periods. Know that if you have more male hormone than female, that's going to cause problems right away. Because if male hormone is taking over, then female hormone is going to decrease by percentile from where you should normally be. What do I mean by that? Well, we know from before that normal ovarian function for female is going to have this kind of bell curve drop down for normal ovarian female levels. In polycystic, it is the red. You will actually go up like a teenager will go up, but then you may spend some time up here normally, and you will spend other time down here because the male hormone takes over. So throughout the decades of your 20s, 30s, 40s, you're going to have variable amounts of time when you are where you should be, and the other months where we really don't want you. And this is normally where you're going to have your abnormal bleeding, your abnormal periods. But know that some women may be up here once every 4 months. They may not even realize they have polycystic ovary. They may have no trouble getting pregnant. It may take them 6 months, 8 months, and they figure, well, that's within normal range. If instead you spend more time down here and you're actually down here 8 months and you spend 1 month up here, it may take you much longer. You may actually have 1.5 years, 2 years before you realize that you can get pregnant. You may then be starting your family planning late, and you don't have that kind of time. So my suggestion to you is, if there is any question that you may be spending time down here, and how would you know? You wouldn't know unless your hormone levels are checked. That means blood work. So getting your blood work done for not just your female levels, estrogen and progesterone, but for your total and free testosterone. You need to know all 4. And when I'm trying to answer the question for somebody as to whether or not they are a polycystic ovary patient or not, I usually check them every 3 months, because that's the only way you're going to catch somebody that's down here for a longer period of time. Because if you're just guessing and once in a while you're checking, you're going to many times only catch them when they're up here. So if you truly are that patient who's having abnormal bleeding, or you're having trouble getting pregnant, and even if you're starting late and you want to make certain that this is not an issue that you have, please check with your healthcare provider. get your blood levels checked for female and male hormone levels. And if your male hormone levels percentile wise are higher than your female, then consider that you may actually be dealing with this genetic condition, polycystic ovary syndrome. We'll have more on the next edition of Hey Doc, What's Up?